no matter how you needle, the overall result is parasympathetic dominance. However, we can leverage that fact and make that outcome much, much more significant if you're specifically focusing on treating the autonomic nervous system rather than the underlying condition itself. So if you're treating the autonomic nervous system, you guys, you're always going to be led to treating the area of primary complaint because that just makes sense, right? Like if somebody comes in with a knee problem, you're going to treat the knee. But what most people do is they just treat the knee or like just that leg and they forget about treating everything else because they're not thinking about the human body in the proper way. The way the body works, if you have autonomic homeostasis, the 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 base if you have autonomic homeostasis, the typical condition of the human body is health, right? When you go into unhealthy land, the autonomic nervous system becomes more dysregulated into more chronic sympathetic hyperactivity. Just to recap what we've talked about so far. So think about dry needling using this two ways. We want to specifically regulate the autonomic nervous system from the chronic sympathetic hyperactivity back towards a relative neutral. The two easiest ways to do that are treating as much soft tissue pathology as we can, which increases mitochondrial oxygen saturation. It increases the amount of energy, ATPs, those mitochondria are producing by 18x. And we want to target the parasympathetics themselves, which also inhibits sympathetics. So now we're approaching depressing the sympathetics from two different ways.